Have you been scared by these headlines claiming that COVID causes lung mets after breast cancer? Well, I'm Dr. Liza Reardon, and I'm here to put your mind at ease. Now, the study published in Nature looked at mice with HER2-positive breast cancer. Their lungs were seeded with hibernating breast cancer cells that weren't actively growing, and the mice were then infected with either the flu or COVID. Now, in a couple of days, those dormant cells started to grow and multiply and form nodules in the lungs. 2 weeks later, the cells went back to sleep again. The scientists found that an inflammatory cytokine called IL-6 was largely responsible for the increase in growth. When they genetically engineered mice that didn't have IL-6, the growth was a lot slower, so IL-6 could be a target for future breast cancer treatment. They also saw that both COVID and the flu weakened the immune system of the mice and stopped it killing the cancer cells. Now, while this is fascinating, we can't extrapolate it to humans like you and me. And remember that these were mice that already had cancer cells sleeping in their lungs. Now, the second part of the study was analysing a database to see the impact of COVID on getting lung mets in people living with breast cancer. The US Flatiron Health database had almost 37,000 women. Now, we only know they had breast cancer. We don't know their stage, grade, receptor status, or how long ago they were treated. Their analysis found that women infected with COVID were twice as likely to get lung metastases. And that sounds scary, I know, but this database was collected before we had the COVID vaccine, and there are lots of other factors that could have contributed to this increase. It could be that the vaccine actually decreased the risk of developing lung mets. But what about that scary number? COVID doubling the risk of lung mets. So if we group every breast cancer together, every stage, every receptor status, the risk of getting any stage 4 disease is 20 to 30%. And a quarter or a third of those people with stage 4 disease will have lung metastases. This means that the lifetime risk of anyone with breast cancer getting lung mets is 4 to 8%, but that's in a lifetime. Another way of saying that is 0.3 to 0.6% per year for the first 15 years after diagnosis. That's up to 6 in 1,000 women with breast cancer getting lung mets each year. And getting COVID or the flu, if you're not vaccinated, increases that to 12 in 1,000 women. Still really small numbers. So what can we really say about this study, and how does it impact you? So this is a fascinating insight into how breast cancer metastases develop in mice. If the same effect is seen in humans, then IL-6 could be a target for future research. And if you've had COVID or the flu, please don't worry, as the increase in you developing lung mets is small. But to be on the safe side, get your influenza and COVID vaccines every year.